Hello and welcome to Workforce Wisdom. I'm your host, Christy Bray, Chief Customer Officer at PracticeLink. This podcast examines the latest trends in healthcare recruitment, showcasing innovative strategies, success stories, and fresh perspectives that are revolutionizing the healthcare workforce. These episodes lead to in-depth, thoughtful discussions with recognized industry-leading healthcare professionals, exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode, Partnering for Better Care, Unlocking Strategic Partnerships with Locum Tenens Agencies. My guest today, Juliane Brown Howard, is a healthcare staffing professional with LocumTenens.com, where she has been with the organization for nearly 7 years. In her role, she partners with some of the largest and fastest growing health systems in the United States, helping them navigate workforce shortages, scale plans, and build sustainable staffing strategies. Juliane is known for her clear communication, practical execution, and ability to support organizations experiencing rapid growth and evolving clinical demands. Her experience spans complex multi-state systems and high-volume environments, giving her a grounded understanding of how to effectively align staffing solutions with both immediate needs and long-term goals. Based in Atlanta, Georgia, Juliane is also a dedicated yogi and enjoys spending time with her husband, Logan, and their dog, Poppy. Welcome, Juliane.
Oh, thank you, Christy. Thank you so much for having me.
So you began your career in retail before moving into the business development world. And in 2019, you joined LocumTenens.com as an account sales representative. What drew you to healthcare staffing, and what was that transition into the locum tenens space like for you?
Oh man, so first of all, I cannot believe that we're almost 7 years into my career with LocumTenens.com. It has just flown by. But in 2019, I was working for an automotive marketing company, similar to like a cars.com. And I remember going on LinkedIn and I was going through my messages, and I had a recruiter message from a in-house recruiter at LT.com. And Christy, I'm not going to lie, when I first got the message, I was like, this must be a scam. What is a locum tenens? I had no idea what it was. Well, I figured out that LocumTenens.com was a part of Jackson Healthcare, which I did recognize. So my mom is one of my biggest influences, and I let her know that I received the message from LocumTenens.com, part of Jackson Healthcare, and she lit up immediately. So for some backstory, she ran an IT staffing company for many years. She sold her company in 2006. But it was very close to where Jackson Healthcare's first office was. So she was very familiar with the company, and she told me to go for it. So I ended up responding to the recruiter, setting up interviews, and before I knew it, what once was supposed to be just an internship, that was what I was originally recruited for, turned into a full-time role at the young age of 21, and I have been there ever since.
Well, that is amazing. And I know your story, pretty well as we've known each other for several years. I think it's impressive that you jumped right into an industry with little to no knowledge and really have grown over the years. And so great job. I think also a little shout out to checking those LinkedIn messages.
Yep.
You never know who might be reaching out to you.
That's right.
So throughout your time, these past 7 years, I know you've taken on several client-facing roles, including how we got to know each other. But you really work to support both the providers and that healthcare organization. Are there some skills or experiences, maybe some turning points that helped you grow into your current role as a regional account partner?
Oh yeah, I could think of so many, honestly. So in my first role with LocumTenens.com, and for the first few years of my tenure, I was a part of a specialty division. So I pretty much exclusively sold locums for just a few specialties. So I did women's health, ENT, urology, and dermatology. It was a little bit more of a siloed way to work. I was only focused on those few things. And so when I transitioned to my role in business development a few years ago, I had to think more holistically and think about the business as a whole, think about all the specialties, not just selling for a few. So I learned a lot in that time when I joined our national accounts team and I started going after these big system-wide contracts. But I would say I learned a lot about listening to understand exactly what is going on with your customers. Instead of focusing on just opening up those job orders or making placements, I had to begin to think strategically and really position myself as a partner to these systems and not just a transactional locums rep. So asking a lot of questions, educating myself on the industry and what's going on in healthcare across the United States, but mainly asking a lot of questions.
Yeah. I think most people know. I mean, listening is that foundational, fundamental skill that goes a long way with anyone, but especially those customers that you're partnering with. You know, as the locums industry has evolved over the last 40 plus years, a lot of that evolution has happened over the last 5 years, given the pandemic and then the physician shortage. So how do you talk about the locum tenens industry being more than just a last minute gap filler, with your clients, and how do you help them really envision how they can use temporary providers to support their communities?
Mm-hmm. It's a great question. So you're totally right. I think locums for a long time was kind of a bad word. You think of a locum clinician coming in, it could be a physician with maybe a weird background, lots of malpractice, and it's not like that anymore. A lot of the placements that I'm working on and some of the more strategic projects that I'm working on with my clients, it's not about just filling in for maternity leaves, getting those locums in when a permanent provider is out. We're sitting down and we're looking at the big picture. I do a lot of different transition management things. So if a health system is maybe breaking a contract with a practice management group, or if there's any sort of large transition internally, I'm assisting them with providing those locums clinicians to provide that support and to keep their patients seen while they work on their long-term permanent staffing strategy. So a little bit of the transition management has been very popular. I also work with a lot of rural facilities. So I work with these very large health systems, but they are acquiring different sites and even miniature health systems within their state, and they're needing locums clinicians for long-term contracts, not just for a few months. Another thing that I've been doing is helping just provide more education around locums and payers. A lot of systems, well, it's getting a lot better now, but when I first kind of started a few years ago having these bigger conversations, some of them didn't know that they could enroll these locums clinicians in payers so that they could actually bill for services properly. So I think that being a strategic partner means, providing that education to my customers and ensuring that I'm doing everything that I can do. So with enrolling the locums clinicians in payers, it can help them, recoup some of those costs.
One of the things I wanted to follow up on, just for our listeners, and I don't want to disclose too much of how your company is organized, but I think it's very similar to how other locum tenens agencies function. So you've mentioned specialty departments, both on a recruiter side and on a business, right? That sales side. Tell us a little bit about that in, maybe how I think the recruiters listening would be interested to learn that you guys have a very similar function within the agency as you're trying to fill pipeline to fill shifts for them on a locum side.
Yes, absolutely. So internally, we do have these large specialty divisions. So we've got an anesthesia team, surgery team, the list goes on and on. I really love this business model, especially on the recruiter side, because those recruiters who are speaking with those clinicians and filling pipeline for these locums jobs are specialized. Some of our recruiters have been with the company for, 15, 20 years. They've worked with some of the same doctors for a long time. They are so educated in these specialties. So I feel like with having these specialized recruiters, it drives placements to be made faster, candidates in front of our clients faster, and just ease for both the clinician and the client.
Yeah, thanks for that. I know that the more that I got to know, the Locum Tenens agencies that were supporting my healthcare organizations, it really helped to get to know some of those areas. If you have a huge anesthesia need, it pays off to kind of understand and really be able to educate those people who are looking for providers. This is what we expect in a clinician. This is what we absolutely cannot accept. That may be more important. But I think it's very helpful to realize that you guys have a similar model in which you're trying to fill those gaps. I think it's a much more rapid speed than the employment model, but it is very attractive for the providers because they get some of that balance back in their life. So you've mentioned serving as a strategic partner to large health systems and really helping them, these are my words that I use, but to keep the doors open, serve the needs of their communities. What does that partnership look like in your day-to-day? And how do those systems, the needs of those systems differ from the small rule that you mentioned? And maybe there's more of a transactional type account.
Mm-hmm, absolutely. So I support right now 16 large health systems across the country. And I've got to say, Christy, each one is very different. And I support them a little bit differently depending on what their needs are. But across the board, the number one issue is locum spend, contingent spend is out of control. So a lot of our conversations are kind of sitting down and looking at where are these systems spending their money in locums, which specialties, which sites, and how can we be strategic to maybe leverage some of their internal resources to drive down costs, or maybe utilize telehealth in areas that they maybe are not, and just figuring out how can I strategically help them lower their costs. I mean, locums aren't going to be going away. Every system's going to be needing them, but there's really smart ways to use them. And so a big part of my role with a few of these systems is also helping them learn how to centralize some of their locums and their operations, because you'd be surprised with these large systems, there's no process. Some, department heads have their own relationships with different agencies. No one's really owning anything. There's not a source of truth. So I feel like where I can add value is help them create a seamless process for locums and how they manage their agencies and spend.
Yeah, I think that one of the key things within what you said a little bit earlier is about that provider enrollment.
Yeah.
To make sure that there is value in having these providers come in. Not only are you serving your community, but you are able to offset some of the cost, with that. Takes a lot of coordination though, as you would expect. Are there any emerging shifts or changes that you've seen, maybe how your role has adapted over time to help your clients navigate some of these challenges?
So I have to say, especially in the last few years, technology has been a really hot topic, especially from a workforce solutions perspective. So I understand a lot of my clients, they need a source of truth. They want a system or a software to kind of house all their locums information, manage some of their agencies, just consolidate processes. So I do help make some strategic referrals and things like that to help them. Locums is changing. It's not transactional like it used to be. I'm not just trying to fill jobs all day and open job orders. I'm really trying to be that extension of their team and offer systems that can help.
Yeah, that's great. And I think that a key point for the listeners, there are a lot of technologies out there, from scheduling software to as you work with something that might help you consolidate or really keep your, vendors under one platform so that it's easier to manage. I know the time constraint of trying to, manage locums in a large health system, it's usually not your only job. I know it wasn't my only job. It became that second or third job added to my day. But locums can get really expensive really quickly if you don't have folks watching your contract language, watching to see that you haven't double booked someone. that has happened and you end up paying no matter what.
Yeah.
So you have to really pay attention. And I think to your point, like there is technology available now. There are partners who can help you do that, and really helps to streamline the whole thing.
Absolutely.
Yeah. So we know, we talked a little bit about the workforce shortage, top to bottom. Any industry, we are really going to face these shortages. We're at the very front end of that. We also have the rising patient demand.
Yes.
As we know, the population is aging, and then that increased pressure on the bottom line for these health systems and hospitals. So from your perspective, what are the top priorities and maybe the pain points that your clients bring to you? And how do you work with them to build solutions to go beyond simply, placing that clinician?
Mm-hmm. I mean, everything that you said is very correct. We have an aging population. We have a lot of sick people in the country. There's just such a need for all these providers. I would say one is they just need clinicians to help keep some of these service lines going and keep the doors open in the hospital. So I'm able to jump in there with my recruiters and fill some of those jobs so that they can continue to see patients and not lose those patients to other systems or hospitals within their area.
Yeah. And I think that is, key points. We've talked a lot about patient access. That's the keeping the doors open, which locum tenens clinicians definitely are the key for many communities to do that. We've also talked a little bit about how you help coordinate internally within the large team. I think there's probably over 1,000 people now at your company, but that could be hard, even managing within that team as you're the single point of contact for your client. So how do you balance providing that high level strategic guidance and then really ensuring, you've got that specialized high quality support in each of those clinical areas that your clients need?
So the clients come to me with what they need, whether it be something as simple as just a locums order or something really big. And I'm able to work with our amazing team. We've got these incredible operations teams at locumtenens.com. And I know that if I bring something to them, they will help me help the client. And it's seamless for the client, where the client has literally no idea what's going on behind the scenes. And so I really just have to say kudos to the amazing operations team. So we've got a customer care team. We've got an amazing provider enrollment team. I know we've talked about provider enrollment a lot. And we have an amazing clinical operations team, telehealth. I couldn't take care of these clients on my own. There's absolutely no way I could do it without our ops teams.
I think there's one team that, folks forget about, but your travel team.
Oh,
the people
customer
who
care.
actually
Yes.
that have to move these clinicians sometimes into places that don't have a hotel or a motel, maybe. Right. So it can get very challenging even for what they're doing, trying to move these people around.
Oh, yeah. And just, a couple months ago with all the flight issues and we couldn't get these people on planes. And our travel team was incredible to come up with these awesome, workaround solutions. And we made sure those doctors got to their assignments, but it was pretty bananas around the office for a while. Hopefully things are a little bit more chill now, which is great.
Yeah. I wouldn't want to be, I don't think a lot of people like to travel, around the holidays because it gets so stressful. I know looking at the lines at some of the airports, but think if you were a locum tenens provider, especially a surgeon or something, right? Like you are needed to keep the hospital open that day and there's a delay. that pressure would be pretty amazing. So to have those travel people right there helping you along the way, that would relieve some stress, I think. So let's talk a little bit from the clinician's perspective, because I know that, locum tenens work continues to grow in popularity. You're seeing it even, with residents and fellows coming out, they're asking fairly quickly. They do want to get in and get some experience and some days under their feet working, but these are very attractive jobs because they can really dictate when they work, how much they want to work, maybe even where, or at least within a sphere of where. Are there any trends that you're seeing in why clinicians are choosing these temporary roles over a traditional employed model? And then, how do you help align that with your organizations who they're really looking for that permanent fill when folks out there in the market are looking for more of that temporary role?
Absolutely. So to your point about the residents and fellows being interested in locums work, you were absolutely correct. So locumtenens.com, we attend a lot of different clinician-facing conferences where a lot of the traffic that we get at our booth are these younger clinicians that are really interested in this gig work and the locums assignments, because there is a lot of flexibility. I think what these clinicians, especially the younger ones, are craving is just that flexibility, being able to choose where they want to work and when they want to go to work. And another really great perk of working with agencies like ours is we assist them with all the things that they might not want to do, like obtaining licenses in certain states to be able to practice. We handle their travel, their lodging. It's like they're free agents with us, and it's really exciting and fun. Some of these locums that I've got to know that are younger that work on some of my assignments, they love it because they can travel, see different parts of the country, and still be able to keep up their skills, and they have a lot of fun. So I think that I don't see that changing. I think that these clinicians that are going into the workforce are going to want to continue to have that flexibility. So perhaps there could be opportunity for hospitals to look at, their shift models and things like that to give them more options in their schedule to be flexible.
Yeah, and I'm definitely hearing more openness to kind of sharing, like a job share type program. A lot of new grads that I've talked to, they're okay being paid at a 0.6 or a 0.8 FTE because they want that flexibility and that time back in their, in their life outside of work.
Yes.
So I think that's something health systems, trying to adjust, that it's not going to be a 1.0 FTE every time, and you have to plug some holes with temporary workforce or adjust what that looks like. I know another attractive, you mentioned telehealth. Those jobs are extremely attractive. I think those are probably the first place. If you're looking for that flexibility, clinicians are looking at telehealth jobs first, probably locums jobs next, and then maybe they'll get to that full-time 8 to 5, Monday through Friday employed model.
Absolutely. Yes. Even so, another thing that I help my systems out with is optimizing their float pools. So if you're my boss, don't listen to this part. But because obviously, yes, I love my customers and I love to be able to make these placements and things like that. But sometimes we look at things like, hey, we've got some of these locums that have been working through all these different agencies for you for a long time. Who could you take direct? Perm direct, and just have them in your float pool like a direct locum. That can save you a lot of money. These organizations a lot of money. So it's like, how can we get savvy, keep the clinicians happy, and keep the costs a little bit lower?
Yeah. And I know we worked on several of those together. And, for those recruiters listening, if your organization is open to it, these can be pretty simple PSA hourly rate contracts. Again, you have that stickiness with the provider. You know them, they know you, they're comfortable in your facility and in your community. And you're still able to provide that support. I'm not saying it, you don't want to cut all of your locums to move to that, because it could be hard with a whole bunch of PSAs to manage as well. I appreciate that you talked about the flow pool model. We see nurse staffing internally for organizations that has pivoted very quickly, where they are able to absorb and develop their own float pools if they didn't have them, where for nurse staffing, that has taken a large hit in terms of that external need. It feels like especially for physicians and then APPs more broadly, Locum Tenens is a little protected from that. Mm-hmm. Yeah, and you've got, I think, it's probably due, that licensing, credentialing, and then maybe even that payer part. Yeah. That they kind of insulate you from what happened to the nurse industry over the past 2 years.
Yeah. I would say so. Especially the malpractice piece too, that's usually a deterrent because that is a perk of working with an agency. We handle all the malpractice for the clinicians. Sometimes it's something that they don't want to do. But I can see this continuing to change as spend continues to be a little bit out of control for these systems. I definitely think it'll be a trend for them to optimize their, per diem model, their float models and things like that to save some money. I've also been seeing a lot of locums to perms again. So we offer as an agency a locums to permanent placement model. So a clinician can work for 3, 6, 9 months. You can see if they're a good fit. They can see if your system's a good fit, and then they go perm. I've been seeing that kind of pop up more and more. Yeah.
I think the point to this is like every employment model or relationship model needs to be looked at. You kind of have to open the box and just see what works for your system, your community. And again, the focus then to provide that patient access.
At locumtenens.com, we believe what's possible gets bigger when smarter solutions work together. That's why we offer a comprehensive suite of workforce solutions designed to help healthcare facilities see patients faster, protect revenue, and maintain uninterrupted care. From short-term coverage to long-term support, we connect facilities with top clinicians across every specialty. And whether it's staffing, telehealth, or transition support, our flexible solutions help ensure uninterrupted patient care without adding complexity. Because today's challenges don't have one-size-fits-all answers. They require a partner who can adapt, scale, and solve alongside you. Locumtenens.com. Smarter solutions, stronger partnerships, lasting results.
We talked about technology and how it can support, especially when you're managing locums or staffing, any staffing across a system. Are there some key metrics or KPIs, kind of some indicators that you help your clients focus on so they really make sure, they're well served, they're on track, they're staying maybe within their spend budget? Anything that you typically recommend or provide to them?
Oh, yes. And Christy, I remember when you were my customer, we were all about the data. So we were sending each other reports all the time. So I have continued to do that with my customers now. So a couple come to mind. I send these monthly reports, and we have a really amazing tool, technology tool that we offer our clients that I'm able to pull some of this information from. They have access to it too. But some of the things that we look at are spend by specialty, spend by facility. We look at expenses. We always want to make sure the expenses are lower than what we're billing for the time, right? So we make sure that's good. We look at the days to fill, or how long it takes to fill an order. That's more of a metric that shows if LT.com if we're doing a good job, right? Filling these jobs that we're given. We also look at fill rates. So how many jobs the system gives me and how many I can fill. That's a really important one that we track. And on a quarterly basis, obviously it's up to the customer, but I love to go face-to-face and share a quick quarterly business review with all of those metrics as well, just to talk through them. I'm trying to think of any other really good metrics that I love to share. Feedback. So clinician feedback and customer feedback. So we've really optimized the way that we handle clinician feedback and customer feedback. And I like to share these survey results. So pretty much every time a clinician goes on an assignment, they receive a link to fill out a survey, sharing their feedback on their assignment, their feedback about us, their feedback about the client. And those are always things that I love to share. Sometimes the information is a little arbitrary. It's like, oh, I didn't like the Hampton Inn that I stayed at. Maybe that's not super helpful, but sometimes we've gotten some really good tidbits that I've shared with my customers. And so I love surveys and those types of things.
I know that clinician feedback was helpful in some of the things we changed. And I would say for those listening, this is where you learn how good or how poor your onboarding process is, because as these temporary clinicians come into your facilities and clinics, they should still go through and receive the same type of onboarding as a full-time employed provider would. They still need to have badges. It's not just here's the bathroom, here's the locker room type of a thing. If you do it right and you really approach it they're serving your patients just like these employed providers, it creates a very good experience for them. I know one of the things we learned was the cafeteria closed. This was, night shift, person coming in to cover night shift. There was no food available. And it was a town that maybe had one or two fast food. Nothing was open. And so that was a key thing to say, okay, well, let's just put maybe some grab and go things in the doctor's lounge so they could go in and get that if it was off hours. But those little things that I think we take for granted, food, where to park.
Parking is huge, Christy. It's always parking. Yes.
Yeah. So just making sure if you're working through the onboarding process of these locums and bringing them in, I just would really encourage you to mimic anything you've done already. You don't have to do anything new. Just mimic what you've done so that they feel welcome and that they are providing just the highest quality of care to your patients.
Absolutely. One thing that we try and implement with all of our placements. So we've got this amazing onboarding sheet that we have the client fill out so that we can share it with the provider so they know who's going to come get them, where do they report, things like that. But we also share an onboarding packet with the site directly, with the clinician's picture and their name and maybe where they went to school and things like that, where they could, print it out, put it in relevant spaces so that the rest of the staff knows, okay, there's going to be Dr. Jones the locum. He's going to be here next week. Those types of things feel really small, but they're meaningful. They're so meaningful to that onboarding experience for the clinician.
Yeah, for sure. Things don't always go well for your clients or for these clinicians, especially, in a rush. We talked a little bit about COVID, but there's definitely some heavy times for staffing. Do you have some examples of challenging situations where, through collaboration and partnership with your clients, that you were able to quickly turn things around and implement a solution?
When we're dealing with people, even though they're providers, just stuff can go, a little wacky. It happens. It totally happens. I actually had a situation very recently with a very large customer of mine, and thank goodness that her and I have a really awesome relationship. But we had a doctor who was supposed to be reporting to work for Thanksgiving, the Thanksgiving week. And he was a gastroenterologist, and, he had cases scheduled, we needed him there. And there was a little bit of a kerfuffle with credentialing, and apparently he was abroad for a few weeks before these dates. He was, overseas on vacation, and he had to get some drug screens done and things like that in order to obtain his privileges. And it was just a little bit crazy, but I think with the over communication with us and the provider and with the client, we were able to get everything figured out. He was able to obtain his privileges. He was able to go to work. And honestly, the situation kind of strengthened our relationship, the client and I, as we were navigating this thing. But I would say with locums, expect the unexpected. Things happen all the time, but it's so important for you as an HCO or as a physician recruiter to, be very mindful about who your relationships are with these different agencies. I think having that strategic partner and someone that you can trust at the agency just makes all the difference. And with this situation that we had with this GI provider, at the end of the day, the client trusted me and she knew I was going to figure out a way to get this thing done and taken care of, and it all ended up working out.
Yeah, I think what I learned, providing locum support for my health systems, locums emergencies do not happen during the regular work day.
No, it's always after hours.
After hours, usually on a Friday, and you're trying, you're scrambling. So I would just really emphasize that need to have that single point of contact and that tight relationship with your vendor partners to make sure that you've got somebody you can call. You can text,
Yes.
something where they can urgently help you. They have teams that are willing to help. And so, just making sure you have those connections with your agencies.
Absolutely. Absolutely.
So let's talk a little bit about some of the work that you've done or that you see in the industry to support access in rural communities, these underserved areas. We know over the next decade plus, these areas are just going to come under even more tough times in terms of the shortage. As you support those clients, how are the strategies different than, when you're supporting maybe these large multi-state systems? So these are maybe a critical access hospital. We talked a little bit about travel being an issue, just getting to the facility, but how do you support them and maybe create a strategy that looks different for a larger client?
So with these rural facilities, kind of what we talked about in the beginning of this conversation, these rural facilities need these clinicians to keep their doors open or keep service lines going. So it's very imperative that we act quickly to provide the right talent and the right clinicians to be able to fill those roles. We have gotten creative with some of these rural sites because it can be hard to find clinicians that can go in person, or sometimes there's cost constraints for the client where it's just very hard for them to pay the locums fees as well as paying the travel and lodging for these long-term assignments. So I've mentioned before that we have a clinical operations team internally and a telehealth specialist team, which those telehealth folks are incredible, and they have been able to successfully create and launch these teleprograms that have totally benefited these rural communities. And the tele thing, it's kind of interesting. It's not just the primary care or the radiology tele, it's dermatology, it's maternal and fetal medicine, it's these other specialties that honestly I wouldn't have thought tele could be an option for, that tele is an option for. And it's just really greatly helped these rural communities and these smaller systems that we support.
Yeah, I would say in many cases, the tele specialty option has opened up these communities to some specialties they may have never had.
Yeah.
In some of those cases. So definitely a good avenue if you're looking at your whole workforce and your staffing continuum. Plugging those types of folks in can be super beneficial in your rural markets.
And I would say another thing. So obviously with most rural markets and most rural hospitals, they're wanting physicians. But if you can use an APP, do it. And we have a very large advanced practice team as well. So we staff lots of CNMs, CRNAs, all different types of advanced practice providers. There's so many APPs that we have in our database and that we work with. And so I found that in some circumstances, especially in rural circumstances, we can provide clinicians faster that are APPs instead of a medical doctor or DO. So just something to think about. Yeah,
that was usually one of the top three, maybe the first or second question that I would have my facilities answer. I know that we're trying to fill a gap of a physician, but is an APP an option? They're usually operating at a very high point in their licensure to come and provide those services. So we've talked about, the external partnership and supporting your clients, and then that internal partnership with the teams that you have. Tell me a little bit about how a locums provider is supported by an agency like LT. You mentioned med staff. You've got some credentialing and travel in there. Anything else that recruiters may not know? You have these core components functioning there within the agency.
Yes. So behind every placement, there are 10, 15, 20 people internally that help make it happen with LT.com. So these clinicians, our goal is to provide a seamless experience for them before their assignment and during their assignment and after their assignment, because hopefully we do a good job so that they want to work with us again on their next one. So every time we have a placement there, we have a dedicated CVO team internally. So like a medical staff office team that helps work with your MSO to get them payer enrolled, get them privileged, credentialed, all of that. We also have a travel team that's available 24/7 to book all of their lodging and their flights and be there in case the travel snafu happens and all of that. And then obviously we have our team of recruiters that own the relationship with the clinician and are also there as an additional layer of support. So I would say for all of our placements, these clinicians are very supported. We even have a mobile app, which has been such a game changer for them because these doctors are on the go. It's sometimes hard to pull out the desktop to pull everything together and piece, together what they need for an assignment. So everything is right there on their phones. But yes, the clinician experience is very, very important to us.
So as you work across these varied communities, are there certain dynamics that that you've found or that can be helpful? It could be cultural, could be within a demographic setting, to really help you tailor your approach when you're partnering with the HCOs. So maybe from the recruiter's perspective, these are some things that if the recruiter shared them with you or with their agencies that help place providers quicker or that are more of a fit for that organization. Are there some key components, within every community that you it would be helpful to know before you start recruiting these clinicians to come in and work these assignments?
So most of the time where we're placing these locums clinicians or we're working on these job orders for these health systems, most of the time I can assume that there's some sort of permanent placement search that's going on in the background while we're providing these locums. And a lot of these systems that I work with do a really good job of creating like a one-pager of some of the amazing things that are going on in their communities, things that these providers would want to know. And we share those things with the locums clinicians that we're recruiting to fill the roles within these systems. So for example, if you are, in a beautiful, like a mountain town or something, and there's lots of bike trails or hiking paths or things of that nature, please share it with me or with your locums rep so that we can make sure that that's being communicated to our internal recruiters and that we're sharing those amazing things about your community with the clinicians. On the flip side, if you have like a very tiny town and maybe there's only a couple restaurants, that's also something that maybe would be helpful for us to know as we're recruiting so we can make sure that we've got the right fit, going to your assignment. Maybe a New York City person wouldn't be a good fit for an assignment like that. So I would say just share as much as you can about your community with your locums rep so that we can make sure that we adapt our recruiting strategy to best fit the needs of your community and find a good, fit, because like I mentioned before, sometimes these locums clinicians do go permanent, and that is something that sometimes we recruit for. So we want to make sure that yes, clinicians that we're sending to you are good for these short-term assignments or even long-term assignments, but also it would be good to know if they'd be a good fit long-term as a permanent provider. You just never know. So the more information, the better.
Yeah, I think the approach that I tried to use or encourage my teams to use, again, don't recreate anything, but if you are recruiting for that perm position, a lot of that information you've gathered either from the clinic or maybe the service line director, share that same information just like you would on a permanent job posting. That's what the agencies are doing for you. They're posting those jobs as well. And so if you have some of that information, it's a very competitive landscape for any clinician right now. So if you're looking for that neurosurgeon, you're competing against all of those other jobs that are available to them. So any of those things that can make it more attractive to your community are super helpful. I know in some of the states that I've helped help staff, licensing can be a barrier, or that time to get a state license can be a barrier. So if you are in a compact state, that works to your advantage, and make sure that's communicated to your agency.
Mm-hmm. Absolutely.
Yeah. All right. So from your vantage point, what really distinguishes a truly effective client staffing partnership, and that relationship? We've talked about moving away from that transactional relationship into this, partnership solution model. Mm-hmm. So what really distinguishes what are some of the qualities there, or maybe the behaviors or best practices that recruiters should be looking for in the agencies they work with?
Mm. The first one that's coming to my mind is flexibility. So locumtenens.com we're a large company. But I think it's really important to be able to be flexible to meet your clients' needs, because like I mentioned with these, systems that I'm supporting, none of them are like the other. They all are totally different. And some of them have different needs, process needs, things that we've had to do internally to realign how we work to make sure that we're providing the best service to them. So I think having a little bit of agility and being flexible is really important. The agencies that you choose to work with should be flexible to meet your needs and not the other way around, because no system is one size fits all. No locum strategy is one size fits all. It should all be very flexible, if that makes sense. I would say too, look at the track record of the agencies that you engage with. There's lots of reviews out there. I would really vet out all of your agencies that you choose to engage with. Just so you know kind of what's going on with those agencies. I would also reach out to just different peers within the industry through AAPPR and other networks like that. Ask around and get recommendations that way. I think word of mouth is still so amazing. And I love our industry because it is very large, but it also feels small. Like with AAPPR, everyone kind of knows everyone. So make sure you're asking your peers and colleagues for recommendations on firms. I'm sure they will give you their honest feedback.
Yeah, absolutely. I do think they'll give you the very honest feedback.
Yes.
Do you advise your clients to create one standard template contract when they're working with an agency? As you have a new client come on, is it helpful if you're working within standard contract languages so all of the agencies are on the same playbook? And then for the client, that makes it easier to manage.
Yes, that is very helpful. And so I think it goes back to the flexibility thing, right? So all these different agencies, of course, have their own contracts on their paper that they send to the health system to sign off on. If you can, sometimes it's really great to have your own, and I'm talking health system, standard contract. You could obviously pull things from these different locums agency contracts that you see, because your supply chain might need some support with creating something like this, or whomever handles contracts for you. But I think it is really great to have some standardization across the terms as well as rates, just so that it levels the playing field. Exactly what you said. Some of the systems that I work with have become very successful by doing this. I would also say if you're a system that has 40, 50 contingency agreements, maybe look at who you're working with and who you have those contracts with, and maybe shave some down to maybe your top 5 or top 10. Not only will it make your day-to-day easier and hopefully get rid of some of the additional emails and calls in your inbox from all these vendors, but it'll just help kind of streamline things across the board. So when I talk to large clients about, centralizing processes and making things a little bit smoother, I usually recommend to create your own contract with your rates. I mean, obviously there's room for negotiation with the rates, but try and get everything as level as possible and pick 5 to 10 agencies to support you. Usually that's enough. It's enough to have the healthy competition. You're paying lower rates, but you're not overwhelmed.
Yeah, and I think that healthy competition is beneficial for the health system, as they're trying to manage their budget, and kind of knowing over time what the average rate is for that specialty. Okay, so here's what I should expect for hospitalist. Or some cases, I know we saw this a couple of years ago, the CRNA rates just skyrocketed. So in order to be competitive, the clinicians want to take your jobs, you may need to do some of that rate adjustment, maybe throughout the year or every couple of years. But if you have a great vendor partnership, you're able to have some of that data to know where the industry is going. And if you can offer a little bit more or something different, you may have a leg up on your competition, even securing the talent.
Absolutely. You'd be surprised too with some of these even larger systems, maybe like I mentioned, the ones that are very decentralized, maybe, Dr. Smith over in CT surgery has a relationship with, locums firm A, and he's maybe that firm has been exclusively providing locums clinicians to him for a long time. And because he's never engaged other firms, he had no idea that he was paying way over the industry standard for those locums clinicians. So when I was in business development, even for clients that I wasn't working with, I'd go ahead and shoot them our rate card just to use to compare against their other firms. And honestly, Christy, that's how I won a lot of my business, because they were able to see, oh snap, we're being way overcharged for some of these service lines. And they had no idea because they had nothing to compare it to.
Yeah. Yeah, I think that transparency is really, really important as hospitals are looking at their diminishing bottom lines. I think every agency has some type of rate card that is out there and available for recruiters to use. I think one thing I want to add, and I would always emphasize this when I would meet with my locum agency partner, my partners, and I loved that I was welcomed on your campuses, and for all of those large vendors that I worked with, locums is usually not the only or the first thing that a recruiter is doing during the day. So, for recruiters, make sure that as you're working with these vendor partners, let them know, like, hey, I also recruit for 60 other perm positions. This is my 13th hour type job in the day, so that you can manage. Again, like Juliana said, there's a lot of phone calls and emails. It used to be faxes. Hey, do you need a cardiologist type of a thing? But they're doing a lot of business outreach and sales outreach to you. But to help minimize some of that noise for you is, as Juliana said, pick a handful of key partners that have performed for you in the past, and then you're just trying to diminish that or consolidate it where it's a little bit more manageable for you, and then communicate. Be very transparent with, this is what I expect, this is the behavior, this is how you reach out to me, and it may need to be, don't call me, I'll call you. But you do need to lay some of those ground rules down, because it can get very overwhelming very quickly for you as a recruiter who has a lot of other things that you're tasked with during the day.
Yes. Remember, your agencies work for you. It's not the other way around.
Yeah, absolutely. All right, as we start to wrap up, I want to talk a little bit, personally for you. Big growth year. Congratulations on getting married this year.
Thanks.
Very fun
Awesome.
milestone for you. Yes. So as your career path, lots of impressive growth. This is a very dynamic and high stakes industry, as we've talked about this last hour or so. What advice would you give to someone aspiring to move into maybe even locum tenens or healthcare staffing, as they get into more of that partnership, that sounds interesting to them, or that account leadership role? What advice would you give them? Those folks, maybe even folks who are looking to transition roles from, recruiters, and they think, oh, this account management sounds kind of interesting. What advice would you give to someone?
So I guess the first piece of advice would be to educate yourself on this industry. Like you've said, healthcare is very dynamic. Things change every day. And there's a few really amazing resources out there that I subscribe to stay in the know with what's going on in our industry. So first thing would be education. Another thing would be, this is so simple, but to be bold and don't be afraid to ask for what you want. If you're interested in an opportunity with a firm, don't be afraid to send a LinkedIn message, to the firm or to a hiring manager to express your interest. Honestly, Christy, that's how I got some of my jobs that I, had with LT now, is just building those relationships with different executives and leaders within LT and not being afraid to do that. I do feel like in my generation, I am technically Gen Z, I'm an elder Gen Z, but I'm holding on to it. We're a little bit afraid to do that. Not as very communicative as some of maybe the other generations that came before us. But what I think has set me apart is just not being afraid to ask the big questions and, say what I want. I would also say to find a mentor. Christy, you are an amazing mentor to me. I'm so grateful to have you. And I have a couple of others too within LT that have just totally taken me under their wing and have been so helpful to me in my career growth. So find the right mentors and the right people to have behind you to help you grow is definitely a huge piece of advice.
Yeah. No, it's my pleasure to be there for you, and it's been really fun to watch you grow. One last thing before we wrap up, talk a little bit about how important it is to lean into maybe internal education opportunities that are provided at your company, not just LT, but as a recruiter, if I'm looking to move forward or move up, how important is it to lean into those opportunities that are provided to you both internally and maybe external to your organization?
Extremely, extremely important. Any company that even offers continuing education, that is a total green flag. So make sure that you're going for those opportunities. LT, not to, make another shameless plug, but they do an amazing job of offering opportunities for continuing education. We have so many amazing courses that they offer through LT, through Jackson Healthcare that I've been a part of over the years. But I would definitely say to go for those education opportunities internally. And, not to make it about you or whatever, but it's great for your career growth. It's great networking to be able to interact with different, folks that maybe you wouldn't collaborate with on the daily. And it could be a way for you to open up more opportunities for yourself in the future by being a part of those different cohorts and educational options.
Yeah. I think the key there is what you've said with both of those is education and networking, and making sure that you are opening some doors that I think people think the door is closed. But LinkedIn is a terrific platform. AAPPR is a terrific association, but get out there and network, and then start to educate yourself on some of these components within the industry that you may have not known about, and it could open a new door for you from a career path perspective.
Absolutely.
On behalf of myself and everyone at PracticeLink, I want to extend a sincere thank you to Juliana for joining me today on Workforce Wisdom. Your perspective as a regional account partner and a partner in general, have really helped large systems optimize staffing, streamline operations, and ultimately improve patient care and access. So your insight has been incredible during this episode. I know our listeners will take notes and really look at their approach to these strategic partnerships in recruitment and in temporary staffing. For those tuning in, you can connect with Juliana on LinkedIn, learn more about her work and the staffing solutions available through the teams at lt.com. You can explore additional tools, education, and insights for your recruitment journey in the PracticeLink Resource Center at practicelink.com. As always, I'd love to hear your thoughts, takeaways, questions, anything about today's episode. You can reach out to our team at plmedia@practicelink.com. My name is Christy Bray. Thank you for listening, and I'll see you next time on Workforce Wisdom.